Hello everyone, it's Dr. Nikki, the board certified family nurse practitioner back in the house. I hope you're all well and you're staying safe. It's December, the last month of the year, and I hope you and your family and loved ones are doing great and you're preparing for the holidays. All right, let's get into it. Today, I wanted to go over how to interpret your blood test results. First off, I want to let you know that if you do get some tests done, for example, blood tests or imaging, which could be an X-ray, MRI, CT scan, whatever it is, you may get your results before your doctor gets access to it or even gets to review it to see what the results are. So for example, some people have online access to their results, the blood test, and they can access it rather quickly than the provider that ordered the test results. And then once the provider gets the result, depending on what the results are, they will develop a plan, maybe to call you with the results and also to schedule a follow-up. Okay? So, but if you get access to your results before your provider gets access to it, let us talk about how to interpret it. I'm just going to be so plain here so that it's not complicated. When you get your result, depending on what type it is, if it's a lipid panel that talks about your cholesterol levels, or if it's a complete blood count, which is a CBC or BMP, basic metabolic panel, or if it's your diabetes test, A1C, or if it could be anything. It could be an X-ray, it could be anything. For imaging, it's pretty easy, depending on if you had a fracture or they're trying to rule out pneumonia or anything of that sort, and you do like an X-ray, I would just typically tell you to go under impression to read what the impression says. All right, and of course there are medical jargons, so you may not even understand it. It's not really your duty to start, analyzing or interpreting your test results. It's the duty of your provider to do that for you. So if you have any questions or concerns, I would say please refer back to the provider that ordered the test results so that it can review it with you over the phone or in person, and then make a plan on what's next. Maybe you're going to repeat the test in a couple of weeks or in the next couple of months, or they want to follow up and see what's going on or prescribe you medication depending on what the test result is. So I just want you to know. But of course, as I said before, some people have access to their results online and they can quickly access it once it's ordered or once they get the test done, so they have access to it, and they start freaking out or saying, oh my God, my test results looks horrible. And how would you know if your test results look horrible? Some people, some test results, depending on the lab, will have A for abnormal, like beside the particular test that was done, or H, which is high, or low, which is, L, which means low. So you have like a number, and then it will say H or L or A, which is abnormal. All right, so depending on what type of test it is. And that's how you know. If they don't have any number, any letter to it, then it's probably in the normal range. And how you know, you look at the number, it will be your number, and then it will say reference range. So the reference range is the normal. So the reference range is the normal. So for example, if it says 7 to 10, and it says reference range 7 to 10, that means that anything between 7 and 10 is normal, and then it will tell you your number, which is like 8 or 9, or 10 is even okay too, and 7 is okay. As long as it's between 7 and 10, that's fine, and it wouldn't have H or L or abnormal there. But of course, if the number says, if the reference range is 8 to 10 or 8 to 20, let's just say 8 to 20, and your number is like 21 or 22 or 23, it would have maybe H, so which means high, and if it's below 8, maybe 5, it will say L, which is low, or it would just have A, which is abnormal. All right, depending on the lab and the tests, as I said before. So that's how you would pretty much interpret that. But then some people, because they're full, the test results itself or the report may be full of medical jargon like abbreviations, and you might not understand what CKD means. You might not understand what A1C means. You might not understand what some tests, the abbreviations mean. That is confusing to a lot of people. They just see that, okay, this one says abnormal or H or L, and they start, getting worried. So I would say please refer back to the doctor that ordered the test results for you so that he can review them with you. All right. So that's pretty much how you would see your test report, like interpret it. So you see maybe H for H for high, L for low, and then A for abnormal. All right. So let us take a look at this. So I will be reviewing, for example, your kidney health with you. Kidney health is very important. All right. So many people, you might know your cholesterol numbers, you might know your blood pressure numbers, but you need to know your kidney numbers as well. Okay. So whenever we say chronic kidney disease, CKD, you will hear CKD. CKD means chronic kidney disease. Anything that is more than 3 months is considered chronic. So even if it's pain, so when we even rate your pain and say, do you have chronic pain or acute pain? Acute pain means it's less than 3 months that you've been having the pain, and chronic means it's greater than 3 months. So the same thing applies for diseases. So if it's at least 3 months or over, then it's chronic. Okay, and if it's less than 3 months, it's acute. Okay, so we have your kidney numbers, and the one that people do tend to focus more on, or we providers tend to focus more on, is your eGFR. eGFR means estimated glomerular filtration rate. It is measured by a blood test. eGFR means estimated glomerular filtration rate and is measured by a blood test. Okay, and the other one is the urine albumin to creatinine ratio. Urine albumin to creatinine ratio is also measured by a urine test. So we're going to focus on the blood test, which is the eGFR, estimated glomerular filtration rate. The eGFR shows how well your kidneys clean your blood. Okay, and the urine albumin to creatinine ratio, which is the one that is measured by the urine test, shows if there's protein called albumin in your urine, which will mean that your kidneys are damaged. Okay, so we will review the eGFR. So the eGFR, depending on what the number is, can show if you have, tell you the kind of stage you are. Okay, so if your numbers are 90 or higher, all right, or 60 to 89, or 49 to 59, or 30 to 44, 15 to 29, or 15 or lower, then it will give you a stage. And this also can vary depending on the lab that you use. Okay, some people, they will say if your eGFR is over 60, that's normal, you shouldn't worry about it. And some labs use over 90. Okay, so your eGFR number matches with the chronic kidney disease stage. Okay, a higher eGFR number is better because it means that you have a lower CKD stage. Remember, CKD is chronic kidney disease. So a higher number, you always want a higher number. You always remember, higher is better. Higher is better. Higher is better when you're talking about kidney health or your kidney numbers. So if your eGFR, particularly eGFR, okay, not every time that you see a high number is better in some other situations, but for eGFR, a higher number is better. Okay, so a higher number is better because it means that you have a lower chronic disease, kidney disease stage. So as I said, we have stage 1, stage 2, stage 3A, and stage 3B. We have stage 4 and then stage 5. Stage 5 is the worst of all, and it's when your eGFR is below 15. Okay, and then stage 4 between 15 and 29. Stage 3B between 30 and 44. Stage 3A 45 to 59. And then 60 to 89, stage 2, and then 90 or higher, stage 1. As I said before, labs differ. So some labs may use 90, some labs may use 60. Okay, so it's important also once you do your kidney tests, when you have your blood test, you go under, you check your kidney health and you look at EGFR. You may even see where it says EGFR for blacks and then EGFR for non-blacks. So if you're black, then you look at your number. If you're not black, then you look at the other number. Some labs will differentiate like that. So as I said, the type of lab you go to differ. So you want to just make sure that your EGFR is in the normal range according to the reference range. So if you look at the reference range and it says normal is over 60, then you're fine. And if you're over 60, okay? And then if it says your normal is over 90, then you're fine, okay? And if your number is over 90. So just look at your number, your own number compared to the reference range to see if you're abnormal, high or low. And that's how you will be able to see that, okay? All right, so I hope you understand how to interpret your blood test report now. So that's for blood tests. As I said, for imaging, like if you have a CT scan, X-ray, or MRI, I think that it's better for the provider that ordered the test to review the results with you. But typically for me, if I was a lay person, I would just go to the impression section, which is the last section listed on the paper or the report, and I'll read what it says, because it kind of summarizes everything that they wrote at the top. It kind of summarizes everything, but of course a lot of medical jargons you might not understand what it is, and so you still need your doctor to review it with you. And sometimes we have false positive results, and that's why it's very important also that when you see any kind of abnormal results, you try to follow up with your doctor to explain it to you and to determine what steps need to be taken. Some doctors will say, okay, you know what, maybe this is abnormal or false positive, let us go and repeat this test next week, in 2 weeks, in a month's time, and then go from there. Sometimes doctor will want to see you in person to explain better to you in person than over the phone, and that's how they do that. Okay, and I also wanted to point out that sometimes it's kind of confusing when they say positive and negative. Some people will be like, what is positive, what is negative? Because I'm confused. So yes, positive and negative is a little different in medical terminology. When we say something is positive, it means it's abnormal. I know you think that something positive means that it's good, but in medical terminology, it means abnormal. When we say something is positive, it means abnormal. So for example, it means that a disease or substance was found. And then when it's negative, it's normal. So when it's negative, it's normal. It means that a disease or substance being tested was not found. Okay, and then you might have one that says inconclusive or uncertain. That means that there wasn't enough information in the results to diagnose or rule out a disease. So if you get an inconclusive result, you will probably get additional tests. Okay, so just wanted you to know that, negative means normal, abnormal, positive means abnormal, and then there's a reference range, which is normal values. All right, so if your normal reference range says 78 to 85, if you fall below 78, that means it's low or abnormal. And if it goes higher than the upper limit of the normal, then it's high, which is abnormal as well. Okay? All right, so please make sure that you do follow up with your doctor regularly. And whenever you get a blood test done or any kind of imaging, you follow up with the results. Very important. You need to follow up with the results. As I said before, there are different tests that could be done depending on what the situation is. If it's your annual checkup, then they might do a bunch of tests for you. And if it's something specific, maybe because of your symptoms, they might want to order specific tests for you. So you might want to check on your kidney health. They might want to check on to see if you have diabetes. They might want to check, maybe even do some specific testing for cancer, or do some other type of screenings like a pap pap smear or a screen for disease or HPV testing. There are different a variety of tests that could be done. Most people that just go for routine checkup, they might do a bunch of tests, which includes your complete blood count, which is a CBC that I mentioned earlier. All right, so I hope this helps, and I hope that you now know how to interpret your test results when you get them. But as I mentioned, please remember you have to follow up with your provider, the doctor or the provider that ordered those test results, because they are better equipped and knowledgeable to explain them to you in a way that you understand than for you to just go on Google and start looking up things and getting worked up about it. So it's important for you to follow up with the doctor's office. And as I said, sometimes your labs may go out of sync. Sometimes, we have imbalance in your hormonal levels. We have sometimes your sodium may be low, your potassium may be high, your vitamin D may be low, maybe high, things happen. And so sometimes the doctor will be like, okay, you know what, let's recheck it to make sure that this is accurate, and then let's go. Maybe you need medication, maybe you need follow-up, or maybe you just need to monitor. So it depends on the type of test you do and what the follow-up will be. All right, well, take care of yourself, and I will catch you in the next episode. Bye-bye.